So continuing our discussion about the therapy for asthma class. So in this video, we will talk about the beta-2 adrenergic agonists, and I will cover topics including the classification of these medications, the administration routes, the mechanism of action, the therapeutic uses, and the adverse effects. So the beta-2 adrenergic agonists are classified as bronchodilators, same with the muscarinic receptor blockers and the xanthines. So regarding the classification of the beta-adrenergic agonists in general, so they are classified as non-selective beta-adrenergic agonists such as the adrenaline and the ephedrine, and the selective beta-2 agonists, which are subclassified into SABA, LABA, and ultra-LABA. Now the SABA are the short-acting beta agonists such as the salbutamol and the terbutaline, and those have a duration of action of around 3 to 6 hours. Now the LABA, which are the long-acting beta agonists, so examples for those is the salmeterol and the formoterol, and those have a longer duration of action of around 10 hours. And then we have the ultra-LABA, which are the ultra-long-acting beta agonists, and example for those is the indacetyrol, and the duration of action for this is much longer of around 24 hours. Now regarding the administration routes, so the administration routes for these medications include metered dosed inhalers, nebulizers, dry powder inhalers, oral route, subcutaneous route, or intravenous route. And the inhalational route is the preferred route because the drug is being inhaled into the lungs, and this means that there is more concentration of the medication being delivered to the lungs, and there is less concentration in the systemic circulation, and this means that there is less side effects. Now, in acute asthmatic attack, these medications are given by inhalation or by intravenous infusion, while in chronic asthma, they are given orally or by inhalational route. Regarding the mechanism of action for these medications, so they work on the respiratory system by multiple mechanisms, including the activation of the bronchial beta-2 receptors. So the bronchial beta-2 receptors, when activated, this will lead to higher levels of cyclic AMP inside the bronchial smooth muscle cells, and this would lead to airway smooth muscle relaxation and bronchodilation and relief of asthmatic symptoms. Now there is studies that suggest that the beta-2 agonists also work as anti-inflammatory on the airways by reducing the intracellular adhesion molecule 1 and also by reducing the granulocyte macrophage colony stimulating factors release and by stabilizing the mast cells. And stabilizing the mast cell means that there is less histamine release and less inflammation. And these medications are used in asthma diagnosis and treatment, and in treatment of chronic obstructive pulmonary disease. Now let's move on to talk about the adverse effects. So these medications may lead to tachycardia and arrhythmia due to the direct activation of the cardiac beta-1 receptors, and that is because these medications are selective, yes, but not that selective, so they may also lead to the activation of the beta-1, the alpha-1 and the alpha-2 receptors, and activation of the beta-1 will give us tachycardia and maybe arrhythmia in patients with heart disease, and the tachycardia also caused by that the skeletal muscle blood vessels also have the same receptors, the beta-2 receptors, and this means that when those receptors are activated by the beta-2 agonist medications, and this means that this would lead to vasodilatation inside the skeletal muscle and more blood inside the skeletal muscle now, and this means that there is less blood in the systemic circulation, means hypotension, and the heart would try to compensate by reflex tachycardia. Now, these medications also may lead to tremors, and tremors are caused by the skeletal muscle beta-2 receptors activation. These medications may also lead to tolerance, and tolerance means that with the prolonged use of these medications, this leads to receptor down-regulation, means there is less receptors available for these medications to bind to, and this means that there is less effect with the prolonged use. And this would be solved by temporary cessation of the medication. Beta-2 receptor agonists may also lead to hypokalemia. That is because of the shift of potassium from the blood to the cells, and this side effect is used in the treatment of hyperkalemia to reduce potassium levels. Finally, these medications may lead to excessive sweating, anxiety, insomnia, and agitation due to the activation of the sympathetic nervous system. And with that, we reach the end of this video. Thank you guys for watching. Please give us a like, comment your ideas and questions, and subscribe. And this video is a part of the Therapy for Asthma Masterclass. Link will be in the description of this video.